Good morning. My name is Caitlin Hay, and welcome to my informative speech. I would like to begin by giving you a statistic from the CDC. Each year, 923,000 people are admitted to emergency rooms for respiratory-related illnesses and diseases. They're seen by doctors and nurses, of course, but the main medical professionals that are assisting these patients are actually respiratory therapists. Most people don't know what respiratory therapists are or what they do, so today we're going to be discussing, number one, what is a respiratory therapist? Then, number two, why would someone need a respiratory therapist? And then finally, number three, what do respiratory therapists do? So most of this information I'm going to share with you today comes from the AARC.org, which is the American Association of Respiratory Care, dictionary.com, unitypoint.org, and the clevelandclinic.org. So let's begin. First of all, what is a respiratory therapist? So according to dictionary.com, respiratory is a word pertaining to or serving for respiration. And respiration is the act of respiring, inhalation and exhalation, aka breathing. And then therapy, or therapist, most of us know what that is and what they do. However, dictionary.com says that a therapist is a person trained in the use of physical methods, exercises, and heating treatments, etc., in treating or rehabilitating the sick or wounded and helping patients overcome physical defects. So in short, when you put those two terms together, a respiratory therapist is simply a medical professional who assists patients in breathing. So just a little background on respiratory therapy. It actually started back in 1943, and respiratory therapists were known as inhalation technicians, and they simply monitored post-op patients. And then long down the line, we found out more respiratory illnesses and diseases, and they required more long-term solutions and treatments and therapies. Therefore, the title was renamed to a respiratory therapist. So moving on to our second point, why someone would need a respiratory therapist, why they would need respiratory therapy and in turn a respiratory therapist. So according to unitypoint.org, the top respiratory illnesses are asthma, COPD, lung cancer, and cystic fibrosis. So to break those down a little, asthma is the inflammation in the lungs that causes difficulty breathing. It's chronic, but it's also very common, and I'm sure most of you are aware of what asthma is. Then COPD stands for chronic obstructive pulmonary disease, and it's characterized as the inability to exhale normally, again causing difficulty breathing. It encompasses a lot of respiratory illnesses, and the main ones are emphysema, which is caused by smoking, and most commonly caused by smoking, and then chronic bronchitis. So then next we have lung cancer, which is a DNA mutation in the lungs that causes uncontrolled growth of abnormal cells and tumors, which cause poor lung function. And then lastly, we have cystic fibrosis, which is a genetic disease that causes sticky mucus to line up in the airways of the lungs, and again, causes difficulty breathing. These are just some of the respiratory illnesses and diseases. There are a lot more, but those are just, like I said, the main top ones that you would need a respiratory therapist for. So we're going to move on to our third and final point, which is what do respiratory therapists do? So if you've noticed, I'm actually wearing what is called a stethoscope. So this is what respiratory therapists use most often, and I actually own one because I am a respiratory therapist myself. So just to move on to what respiratory therapists do, I can personally tell you that we do these things on a daily basis. So number one, we perform pulmonary function testing. So in order for us to treat what illness you have, we have to test you with a pulmonary function test along with other blood tests and other tests so that we can tell you what kind of disease you have and therefore treat them. Which moves on to, secondly, we also administer medications as well as treatments, breathing treatments and such like that. Not only do we do them ourselves, we educate our patients to do them at home because a lot of the illnesses that I had mentioned are lifelong illnesses, and most people don't want to spend their life in a hospital, so we educate them how to do that at home. So not only do we do these functions, we also serve in a more critical environment. So we work in emergency departments, and our main focus is airway and breathing. So when people come in for traumas, we focus and make sure that they are breathing and their airway is intact so that the doctors and nurses can treat the causes of their injuries. And then in some critical cases, people have to be placed on mechanical ventilators, which breathe for them and give their lungs time to heal. So respiratory therapists are the ones that actually manage those. And then we also, once people are on mechanical ventilators, we also take ABGs, which are arterial blood gases, which help us diagnose underlying conditions and help us treat so that the lungs once again can heal and people can get back to their normal life once they're breathing on their own. So just for a recap, we found out that respiratory therapists, they are healthcare providers that use treatments and exercises to help their patients breathe. Then we found out that respiratory therapists are needed to help respiratory diseases such as asthma and lung cancer, as well as work in emergency departments and manage mechanical ventilators. And then finally, we found out that respiratory therapists do a multitude of things as far as managing those mechanical ventilators, helping in airway and breathing in emergency departments, and then help treat the respiratory illnesses such as asthma and give medications and treatments. So in conclusion, I personally hope you never have to deal with any of the things I have mentioned above, any respiratory illnesses, and I pray you never have to be in an emergency trauma situation. But I want you to rest assured that if by any chance you do, respiratory therapists will be there and they will ensure the best possible outcome. Thank you.